Patients ask, what is a physiatrist? We're specialists in physiatry, which is physical medicine and rehabilitation. Physical medicine and rehabilitation is a small specialty of medicine. Even a lot of physicians don't know exactly what we do. It grew up around World War II with injured soldiers and people that were surviving injuries and needed to be rehabilitated into the best quality of life that they could. So in our training, we see patients that have had spinal cord injuries, head injuries, stroke, as well as musculoskeletal injuries. At Mainline Spine, we specialize in musculoskeletal injuries, particularly spine injuries. I like to describe it as non-operative orthopedics. We're not surgeons, but we treat musculoskeletal conditions like muscle and ligament injuries, degenerative conditions like joint issues, and with our particular interest in spine, we're treating conditions of the spine that would include like sciatica, disc injuries, arthritic conditions, degenerative disc. So we have a particular focus that relies on evaluation patients for function, how to improve the quality of their life through improving function. And it's a little different orientation than other pain management specialties that may learn to do different procedures like we do, but are not necessarily focused on the rehabilitation component. So we do a thorough evaluation with physical examination. Of course, we review studies like x-rays and MRI scans, and then make an assessment of what the diagnosis is and the ways to manage this that allow patients to maximize their quality of life and function. That can be physical therapy. If we utilize injections, often this is to facilitate a rehabilitation program. So, for example, patients that have symptoms that prohibit them from exercising and participating in physical therapy, we may perform an injection with steroids to reduce inflammation and allow them to participate in a physical therapy program. Because if a patient receives a steroid injection and does nothing else, it's likely that will work for a period of time and then symptoms will come back. So the key is to teach patients how to manage their condition, exercise protocols that help to manage the condition, and again, maximize their function and quality of life. And that's really what our specialty is about.